rabies in sheep and goat, facts and fields perspective. Rabies is one of the oldest described disease. The name itself comes from a Sanskrit word called as Rabies, and it is already been described in our ancestral medicinal books like Charaka Samhita and Shushruta Samhita. And it is a leading viral zoonosis as regarded as a global health, public health significance. And we should understand that principal animal affected are dog, and they are the major transmitter of the disease in the world. In some of the parts of the world, it's the whole countries or some of the regions have been declared free of dog-mediated rabies. Like in US and UK and Australia, the countries have been declared as free of dog-mediated rabies. Nevertheless, in Indian subcontinent, we have rabies. We have seen rabies in majorly in dogs and cats and bovines. And it is also been transmitted through wolves, mongoose, foxes, and fortunately, the other part of the world has a bat-mediated rabies, which has not been proven, which has not been said to be true in India. We have never seen a bat-mediated rabies transmission. We do see some of the cases in sheep and goat also. However, these sheep and goat are actually considered to be the moderate risk animals when it is concerned to rabies. And we often see these kind of articles in paper, and mad cow or mad dog or rabies being broken out in a community, and many of dogs biting people and cats biting people. And majority of these diseases, we should understand that this disease comes by a bite of a diseased animal. Rabies is a deadly disease. It's a zoonotic disease. When we talk of zoonosis, first name which comes into our mind is rabies. It's a neurological disease. Rabies, it also comes from a bullet-shaped structure of that virus, which belongs to a genus called as Lissa virus, which is a member of Rhabdoviridae family. And you should understand, I have highlighted that enveloped RNA virus because this is enveloped, the virus readily gets inactivated by variety of commonly available disinfectants, soaps, ultraviolet lights, heat, and even water for long time. This is very important, even water for long time. There are actually 7 lissaviral genotypes circulating all over the globe, but classical rabies virus is caused by the genotype 1, and all other 6 lissaviral genotypes have to be primarily associated with bats and not proven to be present in Indian subcontinent. Post affected, rabies affects all the warm-blooded animals. Remember, rabies affects all the warm-blooded animals. Highly susceptible species include dogs, cats, wolves, foxes, coyotes, jackals, cattle. Cattle is a highly susceptible species. Raccoons, skunks, bats, and mongoose. And WHO has categorized sheep and goat in moderately susceptible species of animal. This may be attributed to a low number of reporting, or most of the time sheep and goat getting bitten by a dog goes unnoticed, and the sheep and goat die because of rabies, and it usually is underreported. Ferrets, primates, and horses are also categorized under moderately susceptible species. The disease is usually transmitted by biting with inoculation of saliva containing virus. Remember, the disease is transmitted by biting of an rabid animal with inoculation of saliva containing virus. Why I stress this is, even if a rabid dog bites, not all the bites contain saliva. Large majority of these cases occur due to dog bite. I said that this about 98% of this disease in India is transmitted through the bite of dogs, and other route of transmission being, in these are special cases. when a corneal transplant or solid organ transplant is done from a patient ailing with the rabies is transmitted to a healthy animal, this is one case, so there are very rare cases, but corneal and organs transplantation can also transmit the disease. And in some of the countries where bat rabies is, endemic, in such cases, aerosol transmissions such that occurring within the caves containing large number of bat is possible, but this is not the case in India. And there are no reports saying that, ingestion of infected tissue or milk from a rabid animal can transmit disease. It's a very big questionable thing, but theoretically it is possible. Dogs, wild carnivores, and bats are considered to be the main natural reservoirs throughout the world. But in India, it is only restricted to dogs, cats, and wild carnivores, to which are considered to be the natural reservoirs of the disease. Now, everybody talks of incubation period. In dog, typically incubation period varies from a week to many months. It always depends on the site of bite and how distant it is from the central nervous system. I wouldn't say it as brain. I would put it as how distant it is from the central nervous system. Most of the rabies cases in dogs develop within 21 to 80 days after exposure, but the incubation period may vary between maybe a short or considerably long. We have reports of incubation period being as long as 3 years from the date of bite. And the outcome after bite from a rabid virus include the proximity, it depends on the proximity of the site of bite from the central nervous system. I again say it is not from the descent from the brain, it is from the central nervous system, and the degree of innervation at the site of bite, and age of the host. Usually young animals and active animals are more susceptible than the geriatric or old patients. Most amount of, mostly the amount of virus inoculated into the tissue at the time of bite is most important for the disease outcome. And neuroinvasiveness of the virus and its variant is very, very important in developing a outcome of the disease. The course of rabies typically lasts from 3 to 8 days. Once that means that once the symptoms are started, symptoms are exhibited, the course of disease and till the death lasts only for 3 to 8 days. So how does this rabies, from the site of bite, how does it exhibit the disease? What is the pathophysiology or pathogenesis of the disease? When the rabies virus, or when a dog or a animal having rabies bites a patient or bites a victim, and usually the virus is inoculated into the local area and it starts replicating in that particular area, it uses myocytes, acetylcholine receptors to enter into the myocytes and multiplies inside the myocyte muscle, that is muscle cell, and slowly once it replicates, we all know that this virus multiplies and comes out of the cell by a process called as budding. Once it comes out of the cell, it slowly gains access to the peripheral nerves and spreads to the motor nerve ending. You can see here the dog, carnivore is biting some other carnivore. The virus multiplies in the myocytes and slowly gets access into the motor nerve endings, and a retrograde transmission into the nervous system, central nervous system, will occur. So it is intra-axonal centripetal spread of the rabies virus into the central nervous system. From the periphery, it will move into the central nervous system. So it is an ascending disease. We call it as a ascending disease. From the periphery, it will go into the central nervous system. Virus replicates then into the spinal cord neurons. See, I said CNS because CNS, spinal cord, is also a part of central nervous system. So it starts its multiplication in the central nervous system itself. Slowly it multiplies into the central nervous system and it gains access into the whole nervous system, causing progressive lower motor neuron paralysis. And once it enters into the brain, it causes the cranial nerve deficits and behavior changes. Why I am stressing this is, once this virus enters into the nervous system, it is a dead end. There is no treatment. There are very, very, very few drugs which cause, which can cross this blood brain barrier or blood CNS barrier, and this disease does not have any cure once it enters into the central nervous system. So once it multiplies into the brain, then slowly virus moves out of the peripheral nerve and moves out through the peripheral and cranial nerves, and it can be seen in the secretions from salivary gland, skin, mucosal surface, and gut, and most of the other organs. It can be seen in all the organs except for the blood. Remember, there is no stage of viremia in the disease rabies. Virus never ever enters into the blood. If you take a sample of blood and if you try to isolate the virus, it is impossible to identify this virus in the blood. Trigeminal nerve is a bigger cranial nerve, the thicker cranial nerve amongst all. It innervates all the salivary glands. The virus easily gets access into the salivary gland and it is secreted through saliva. That is why saliva is very, very infectious. Saliva from a rabid dog or rabid animals is very, very infectious. The saliva, some people ask me, how many days prior to the exhibition of this disease symptoms do you find virus in saliva? So it is, several days before the clinical symptoms are exhibited, we can trace the viral particles in saliva. We should remember, not that the dogs start showing, dogs or any animal start showing disease symptoms and then only you find viral particles or active viral particles in saliva. No, it is days or up to weeks before the exhibition of signs or symptoms, the virus starts appearing in saliva. So presence of virus in salivary sample indicates that central nervous system is already been completely infected. So as a bookish way, so typically we classify this, differentiate this to rabies virus in two different categories. One is street virus and fixed virus. Street virus are found in naturally infective cases, like naturally occurring cases we find street virus, and whereas the fixed virus are they are seen in their all their activities fixed. May it be its replication, period of replication, duration of replication, everything is fixed. That's why it is called as fixed virus. And these fixed viruses are usually seen in the laboratories, not in the field condition. So we have a potential threat on about potential threat with the street virus, not with the fixed virus. So these street viruses are usually seen in the natural occurring cases, and it is naturally occurring virus. It is found in saliva of the infected animals, and as a pathophysiology of disease, it produces typical negri bodies, which was a gold standard test in earlier days. Now it is not. Demonstration of negri body is not a gold standard test. Typically, this incubation period of this street virus may vary from 2 to 1 year, 2 weeks to 1 year. I mean, 2 weeks to 1 year. It can be shorter as 2 weeks, that is 14 days, and it can be as longer as 365 days, that is 1 year. So, whereas in fixed virus, the incubation period typically ranges from 4 to 6 days, because it is a laboratory based virus and we have already fixed all its activity. The pathogenic property of this street virus is it is to all mammals, all warm-blooded animals, all mammals in the sense, not whales. Whales are some of the sea mammals, like whales and all. They are not infected with the cold-blooded animals, are not infected with this thing. All warm-blooded mammals are infected with the street virus, and it cannot be, remember, street virus cannot be used for preparation of any kind of vaccines. But whatever it may be, we should remember that all Indian strains belong to genotype 1 only. Lissa virus has nearly 12 to 13 genotypes, but all these viruses belong to genotype 1 only. Human mortality due to rabies is usually 97 to 98% of rabies deaths. They come from a dog bite. That means dogs are the major, transmitters of disease. You should remember that 40% of these cases come from children. It is seen in children, because these children, especially school going children, or labor class children, they're always in touch with these dogs, and they try to disturb the dogs, they try to aggravate dogs, and they try to do all kind of mischievous things with the dogs. And 40% of these cases are reported in children. You can see in picture, you can see how horrific the dog bites can be. These are all pictures taken at KIMS Bangalore, Kempegowda Institute of Medical Science, Bangalore. And this paper was presented in World Rabies Day at Anand Veterinary College in 2014. Now, how inflicting the dog bites can be in sheep and goats. You can see pictures. A majority of us, as a sheep and goat practitioners, we tend to get dog bite cases very frequently in sheep and goat. Of course, we do find cases of rabies in sheep and goat. It can be very, very, very excruciating, and it can be very, very inflicting. You can see all the skin is torn, and nares is torn, and neck is injured. There's an extensive bleeding, and some of the sheep die because of this thing. And dog bite is so effective. This rabid dog especially, they bite so aggressively that sometimes the fractures of major large bone can also occur in sheep. And in goats, nowadays, goats are, especially in cities like ours, goats are free roaming in, roads, public roads, and they are easy access for this community dogs. And sometimes these are the very horrific pictures. You can see some of the very horrific pictures where some of the goats, the whole ear has been torn. There are multiple bite marks on the head of the sheep and goat, and this can be so inflicting. Based on the exposure, based on the intensity of exposure, we categorize these exposures in 3 categories. That is category 1, category 2, and category 3. So category 1 are such exposures where you have touched the rabid dog, or you have fed the rabid dog, or the rabid dog might have licked your intact skin. So here we classify the severity as none. It is not so severe. The action taken is none, except for wound toileting. You have to cleanse the surface with sufficient water and soap. I already told you that rabies virus can be destroyed by excessive placement of the virus into the water. Excessive contact with the cold water can kill the virus, can inactivate the virus. Category 2 exposures are minor scratches or minor abrasions with no or very, very minor bleeding. So here the severity is minor. You have to take a little concern about this, and local treatment and vaccinations are to be recommended in category 2. Remember, in category 1, we are not asking to get the patient or victim to go for vaccination, but in category 2, we start vaccination. In category 3, usually it is transdermal bite with bleeding and licks and salivary, licks and saliva, falling of saliva on broken skin, or a abraded mucous membrane is considered to be the category 3 exposure. Here, the risk of severity is higher, and local treatment, vaccination, and immunoglobulins are compulsory in category 3. Local treatment, vaccination, and immunoglobulin administration is compulsory. most of the time we come across this category 3 exposures only. Whenever there is a dog bite, definitely the transdermal bite will be there. The dog's tooth would have punctured the skin and entered into the local muscle, and definitely it has to be subjected for thorough washing, that is local treatment, application of antiseptics, and start with vaccination. In certain cases where it is too severe, immunoglobulin therapy has to be taken. And some of the myths about this, we have all kind of traditional remedies, none of them will work. In picture 1, somebody is applying coffee powder on a wound. So in picture 2, somebody is applying turmeric. Turmeric is known to be one of the greatest antibiotics, antiseptics ever, but it doesn't work at all. And remember, the wound that is caused by a bite of any animal, for that matter, any animal, it is not to be bandaged. Here somebody is bandaging it. It is not to be bandaged. And application of local remedies like, traditional medicine and application of bandage, somebody is scalding that with the hot iron, it is not to be practiced. And remember, never handle a case of dog bite or animal bite with the bare hand. And also for our fellow veterinarians, we should suggest that never handle animals, especially oral cavity and rectal examinations, without a proper gloves in hand. So all these can be, it should be avoided to, be safe, be away from the rabies cases. Here, data shows that all the cases which are treated after the confirmation of rabies have died. That means this disease rabies is 100% fatal disease. There is no treatment for this, and there is only vaccination can prove to be protective. That is what I said. Rabies is a 100% fatal disease, but it is 100% preventable disease. No treatment for this disease, only vaccination can be a life savior. Now let us learn about, let us understand what are the different clinical symptoms that different animals exhibit. Especially I said the dogs are major reservoirs in India, and usually the forms of disease in dogs is categorized as 2 different forms, that is furious form and dumb form. In furious form, the animal will generally be attacking on other animals or inanimates or anybody which comes across it. And usually the normal dog start biting. Normal dog, a friendly dog, if it is infected with rabies, if it is rabid, it starts biting. Or self-inflicting wound. If it doesn't get anything to bite, it will bite itself and cause self-inflicting wounds. And usually the dog becomes hyperesthetic to sound and light, and it becomes nymphomaniac. This is very important, in the dog breeding season, especially in community dogs, free roaming, what you say, stray dogs, the nymphomania is one of the dangerous signs. Whenever there is nymphomania, the dog is in heat and the male dogs try to, mate it, and then these dogs start biting at everybody, and then the disease spreads in no time. And usually the destruction of bedding in domesticated dogs, the pet dogs, they start destroying its bedding, the normal, which is not a normal habit of it. So, and usually generally what we see is we have seen fly catching behaviors in this furious form rabid dogs. And in dumb forms, usually they lack appetite and it's very difficult to diagnose. And usually there will be a dropped jaw and paralysis. Usually they do not respond to any calls, or they fail to respond to their, fail to recognize even to their owners, and they become dull, and finally they die. But amongst this, some of the overlapping symptoms between this, furious form and dumb form are dropped jaw can be seen even in furious and dumb form. And these dogs are usually known as territorial animals, but this rabid dogs, they forget their territory and wander away from their usual territory. I have seen in my own place a dog having bitten across about 36 kilometers at a stretch. It started from one place and people didn't know that it was a rabid dog, and it kept on biting. Over a period of 2 days, the dog had bitten different animals in different areas, which at a distance of 36 kilometers. And there'll be change in barking sound, irregular or irregular clustered breathing, constriction of spasm or throat, and muscle incoordinations and abnormal posture. All these are, overlapping symptoms between furious and term forms. Now we are concentrating on sheep and goat, and most of the symptoms in sheep and goat, they correspond to the symptoms in large animals, that is ruminants. That's why I put it as ruminants. So excessive bleating. So I didn't put it as a bellowing. So typically rabid sheep and goat, they start beating excessively, non-stop bleating will be there. Headbutting will be there. Aggression will be there. And head pressing towards the wall will be there. And change in the voice and soundless, bleating, that is called as yawning, and lack of appetite. Sometimes they start eating whatever it gets, pica, that is called as pica. And even in ruminants, we have seen nymphomania, especially in large animals. When we go for artificial insemination, we see some, neurological changes. And if you do a per-rectal examination, the animal is in perfectly heat, but 2 to 3 days later, it starts developing typical rabid symptoms. So need to be careful. If you find any kind of neurological symptoms, the animal is, you have been called for artificial insemination, you need to be really, really careful. And when you find neurological symptoms, you need to definitely take a call on rabies. And muscle incoordination, tremors and seizures. So photophobia will also be seen in some of the sheep and goat, not in large animal. Sheep and goat, photophobia is seen. Abnormal posture and tenesmus is a normally seen clinical symptoms in especially the ruminants. Horses, usually they have excessive whinnying, and especially horses are having aggression, and they have biting tendency. They start biting at everything, whatever they get, may it be a cart or may it be a wall or may it be a rope which is in, it is tied with, or a stable or whatever it is. So whatever it gets, it starts biting. Horses do have a biting tendency, and ataxia is usually seen. In cats, restlessness and aggression is a commonly seen clinical symptoms in rabies. Increased vocalization, loss of appetite, disorientation, weakness, and seizures are commonly seen in cats. In laboratory, when rodents are injected with this rabid, street rabies viral, from the clinical samples, if you want to perpetuate or increase the titer of your available virus, so you go for mice inoculation. And usually the talism, the moist matted fur around the mouth, is a typical indication of that the symptom is already started. Because the mice, even though they live, rat and mice, even though they live in a dirty atmosphere, they're considered to be most cleanest. You don't see a dirty rat, matted or dirtily, all hair entangled rats. So they're very clean in that sense. But talism, excessive salivation, moist matted fur around the mouth is typical indication of rabies. Of course, in certain areas where the prick practice is commonly seen, in pigs, very rarely you find any kind of neurological symptoms. They undergo depression. Pigs will usually develop difficulty in walking, and their nose stitching will be there. Rapid chewing movements of maxilla and maxillomandibular joints, excess salivation and muscular presence, tremors, seizures, and prostration will be seen in case of pigs. But I have never used a word called as hydrophobia. You should remember, there is no stage of hydrophobia in any kind of animals. Fear about water is not seen in any kind of animals, because this hydrophobia is typically seen in humans, because humans have a well-developed memory. It is attributed to a well-developed memory in humans. When a human rabbit patient sees water, he recapitulates his earlier experience about drinking water. He has a potent muscular spasm and paralysis of pharyngeal muscle, and as he starts drinking, the muscular spasms will start and he'll have an immense pain in the throat. So that particular memory at the sight of water itself will be exhibited. That is why it is called as hydrophobia. And this hydrophobia is seen only in humans, not in any other animals. So ideally, what do? You are in a clinic, you get a dog showing a symptom or sign of rabies, and what do? Usually the dog is deteriorating and signs are improving, increasing. So you determine that it is rabies, and it is advised that the dog needs to be euthanized and tested for rabies. In case the dog doesn't show any kind of certain symptom in a symptom of this rabies, so what do is you quarantine the dog for about 14 days. If there is no clinical symptoms, then veterinary assessment is done, and then the dog is left free. And if it within 14 days if develops or suddenly it dies, go for testing, and you have to confirm the presence of or presence or absence of the rabies virus in that particular dog's brain sample, which can be done only after postmortem. So how do you collect samples? See, collection of samples, we have in field veterinarians, we have a great apprehension of collecting samples. My fellow veterinarians usually, I have seen people getting afraid of doing a postmortem on a rabid animal. So usually I said rabies is an ascending infection. It moves from the periphery and it enters into the central nervous system. It multiplies in the central nervous system and enters into the brain. If it has to enter into the brain through central nervous system, usually the brain stem is a very good sample of choice. Earlier we had to go for hippocampus to demonstrate negri bodies. Usually negri bodies are demonstrated only in the samples from hippocampus, but it is not the case at present day. The brain stem is said to be the gold sample of choice. The sample of brain obtained and stored under field condition in 50% glycerol saline, that is 50% of glycerin and 50% of normal saline at room temperature, can be used up to 60 days for all these laboratory tests. It can be used for rabies viral RNA in 5 to 6 year old preserved sample can also be used for viral RNA demonstration. So earlier our traditional method was removal of the brain from dog. Whole brain has to be removed to get the hippocampal sample. So there are three different methods. One is hammer and chisel method, one is bone saw or hacksaw method, and the third one is electric saw method. One by one we'll have a look at it. So removal of brain with the hammer and chisel method. So you have to cut open the make an incision on the frontal muscle at the midline of the frontal bone, and then you have to lift the skin, and then with the chisel and hammer you have to elevate the skull frontal bone, and then you have to get access to the brain. And then once the brain is elevated, then the whole brain can be exteriorized and it can be removed. This was a very conventional method, and it has a lot of hazard that if the person is not aware that the animal is rabid, and if he is not wearing a proper personal protective equipment or a gown or a mask or a face shield or whatever it is, there are severe chances that there are chances that the splashes may infect the person who is doing the postmortem. And collection of sample, once the brain is collected, exteriorized, and then the sample is to be collected, and whole brain is not required by us. So we have to separate whatever part it is, which is required for the the laboratory diagnosis, and rest of the part has to be discarded. So nowadays, this earlier procedure has a lot of disadvantages, that it has a lot of health risk. So recently, people are going towards collection of sample from the occipital-atlantal joint, from the occipital foramen root for sample collection. In collection is very much being popularized, and it is ideal for use in field, useful in outbreak situations, less invasive procedure than the traditional method, that is hammer chisel or electric saw, whatever it is. It is less invasive, more testing to be done in the laboratory. You can collect whatever samples required, and then it can be tested in laboratories. So specifically we can target 3 different regions. You can see a straw being on a X-ray radiograph. Imaginary straw has been placed. If you go into the occipito-atlantal joint, you can access the brainstem here, cerebellum here, and also till the frontal lobe of the brain. You can sample all the area. So you can use this particular method very easily, and it is very user friendly, and most importantly, it is very less invasive compared to the traditional methods. So sometimes samples, the people are not unable to sample collect the samples and do the postmortem. What they do is they send the whole head itself. When the whole head is sent, it is very easy to collect. You can see the laboratory personnel is collecting a sample directly from the occipital foramen using a ink filler. Regularly used ink filler is been cut from the back side at the bulb, and it is being included inoculated, inserted into the occipital foramen, and then it is pinched off so that the brainstem sample is drawn out. Especially when it comes to sheep and goat, we have a very well defined occipito-atlantal joint. The area where I have marked here, it gives a lot of good access. You have to turn this head distally. There is a postmortem sample. You can see this brainstem here. The occipito-atlantal joint is here. From here, you make an incision on the skin and pass this whatever artificial insemination catheter or a straw or whatever it is, a pipe tube like structure. If you pass, you can easily access the brainstem, which is considered to be a good sample of choice for rabies diagnosis. But unfortunately, in sheep and goat, unlike dogs, you cannot access unless you tilt the head distally downwards. Tilt the head downwards, you cannot access to the all the parts of the brain, because the structure of head itself is such a way that if you cut open this occipito-atlantal region, you can access only to the brainstem. Of course, never to worry, this brainstem itself is a good sample for all kind of laboratory diagnosis. So I hope everybody is clear about this collection of sample from sheep and goat from an occipital-atlantal joint. This procedure avoids the tedious process of risky process of cutting open, breaking open the skull, elevating the skull, and elevating the whole brain from the cranial cavity, and it avoids all splashing and personal hazards, and it is a very easy and very user friendly method. Especially in ruminants, large animals, when you suspect this rabies, India is having a very sacred feeling towards cows, and most of the farmers, they don't allow you to break open the skull in front of them and do a postmortem and collect the samples. In such cases where people have a sacred feeling on their own cows, this method proves to be very effective and very user friendly. See, this is where the brainstem which can be accessed. This is a occipital bone, and this is atlas. So occipito-atlantal joint is here, and from here you can access the brainstem. Veterinary College Bangalore Rabies Diagnostic Laboratory has been giving a great, training, having extensively giving trainings, and different field veterinarians in field of Karnataka, veterinary field of Karnataka, are doing this, following this. You can see how easily, without any of much, invasive techniques, we can access this brain sample. In especially in dogs, you can see how smaller is the, it is almost a hole is thinner than the thumb of the person who is doing a postmortem. In sheep, one Dr. Sunil Kumar is doing a postmortem in sheep. He has access, very with a small incision, he has access the occipito-atlantal joint of this sheep died of suspected of rabies, and it was found out to be positive for rabies. This is a very easy method which can be followed even in sheep and any kind of animals for that matter. And precautions while doing pre-em procedure: the veterinarian collecting sample must have undergone pre-exposure prophylaxis. Remember, most of our veterinarians are not vaccinated towards rabies. They're not well protected against rabies. None of us, most of us are not taking regular pre-exposure doses of rabies vaccination. This is a compulsory. We are at a risk of occupational risk of this rabies. So we are supposed to get every year a shot of rabies vaccination with the advice of our physician. Use of personal protective equipments during the sample collection is most important, and take precautions while handling transportation and ensure the safety of the personnel in the environment, most of the time what we do is we do a postmortem, we tell the owner to bury it, he throws away the carcass, and it is a potential risk for any other scavengers. Samples collected should always be transported in cold chain to prevent the decomposition of sample. Once the sample is decomposed, then it is unfit for certain of the tests, like fluorescent antibody tests. Of course, for certain extent, a gold standard fluorescent antibody test can be done on decomposed test, but it is better to send a sample as fresh as possible. The frozen cold packs are preferred over wet ice. Some people, take out ice from fridge, put it in a plastic cover, polythene cover, and put it with the sample. And by the time it reaches to the laboratory, all the ice is melted, and the sample is totally in water. So frozen ice packs, gel packs are preferred over wet ice, and always see that you triple pack the sample. You have to put the sample in a small container, and this container has to be packed with the polythene cover, and this polythene cover has to be put in a insulated or a thermocol box, and ice have to be put all across the sample container. And triple packing is very, very important. That's what I said. Quality of sample aids in accurate diagnosis and speeds up the diagnostic procedures. So these are some pictures. Those who are interested, you can see these pictures, how a positive slide and a negative slide in a direct fluorescent antibody test or fluorescent antibody test looks like. These are the negative with a no or no, you can see no apple green fluorescence, but you can see brilliant apple green fluorescence in a positive sample. Nevertheless, this sample is creating a small kind of doubt. There is it looks like a small apple green fluorescence, even though sample is negative, it is very ambiguous. So the background is stained with a dye called as Evans blue, and the whole background tissue is stained red it looks red under the fluorescent microscope, and there is no ambiguity in this Evans blue stained slides. This is, it can, I have graded this for our just information for presentation purpose. There is no gradation in these samples, whether it is positive or negative. That's what is required for us. Whether it be a low positive or highly positive, it doesn't make any difference. Positive is positive, negative is negative. but for academic purpose, I have put it as, highly positive. You can see apple green fluorescence all over the slide. This is 3+ slide. The intensity, fluorescent distribution is reduced a bit. This is 2+. See, this is 1+. Only one of the areas it is positive. That doesn't mean that the severity of disease is not, seriously to be taken. Even a single fluorescence has to be declared as positive, and appropriate steps needs to be taken for its, corrective measures, or the victims or bite victims or animal handlers post-exposure prophylaxis. Recently, Central Disease Control Agency, that is CDC Atlanta, has developed a new test called as Direct Rapid Immunohistochemistry Test, that is DRIT. See, this fluorescent antibody technique requires a very costly equipment called as fluorescent microscope, which costs not less than 2 to 5 lakhs in present day. But this DRIT can be done in a laboratory having a simple student microscope. It is an immunohistochemistry test. Again, it is, the principle is similar to that of, ELISA. And it is an antigen antibody reaction. Usually the conjugate antibodies, the specific antibody, monoclonal antibodies are coated with a conjugate dye, and there is a flow, green, magenta or red colored staining of this, all viral inclusion particles. The negative slides are only stained green. The only tissue is stained, whereas the positive slides are highly stained with this fluorescent, conjugated monoclonal antibodies, which appear green color remember, this is in a very small primitive student microscope, which is available everywhere. So all these dark red or brick colored particles are nucleoproteins, that is outer covering of this rabies virus. It may not be a fully grown virus. It can be even partially formed nucleocapsid protein, and everything can be detected in this particular test. Nowadays, there are simple pregnancy diagnostic kit like rapid rabies test kits are available. That is lateral flow assay. You have to collect the sample. These kits are provided with certain equipment, like 1 ml of phosphate buffer saline will be there. One small swab will be there, and a small ink pillar will be there. So you have to take a small piece of brain sample and put it in this. And with using that swab, you have to homogenize in this phosphate buffer saline, and a drop of that has to be put in this particular well. And if the sample is positive for rabies, you get a line at test. If the sample is negative for rabies, you get a line only in the control, not in the test. That means, simple to remember, you get lines in both test and control, the sample is positive. If you get line only in control area, that is sample is negative. That is, 1 line is negative, 2 line is positive. And this test can be done everywhere, anywhere and everywhere. Only thing is, the post-mortem should be done, and the sample needs to be put in this. The small amount of sample is sufficient to do a diagnosis in this particular method. There are certain tests like polymerase chain reaction, PCR, RT-PCR is available for diagnosis of rabies. And, we have developed a new technology called as loop-mediated isothermal amplification. This polymerase chain reaction, it is a costly affair. The polymerase chain reaction thermal cycler will cost you not less than 5 to 6 lakhs, maybe up to 10 lakhs for a good quality thermal cycler. But this loop-mediated isothermal amplification assay requires a simple water bath, which will not cost you more than 20 to 25,000. As a part of my PhD thesis, we have developed a loop-mediated isothermal amplification assay for rabies diagnosis, and it was very, very easy. And it can be, it can be viewed with the naked eye. You can see in positive samples, we have low intensity of color called as, we have used a dye called as hydroxynaphthol blue. whereas in negatives, we have a high intensity of color. As the concentration of DNA multiplication, the titer of DNA goes on increasing, concentration of DNA increasing, the color of the dye goes on reducing. So this is a simple test which needs to be slowly popularized. So we have compared it with the standard available kit, and this is how it looked like. So it was in very good agreement with the standard available kit from Japan. So this test was standardized as a part of my PhD thesis. And let us know a little about vaccination. Rabies vaccine since 1986, 1985, 6th July, we have vaccination for this rabies. Earlier there were 21 injections of inactive formalized or formalin inactivated brain tissue vaccine was being used in humans. Around the umbilicus, there were 21 injections daily were used to be given. Later on, it slowly reduced to 14 injections around umbilicus. Nowadays, since 2005, whole nerve tissue cultured or nerve tissue derived rabies vaccine has been completely taken out from the market. It has been banned by WHO, and from India 2005 we are not using this nerve tissue based vaccine. We are using only purified chick embryo cell culture vaccine or vero cell based vaccine, and the doses have been reduced to 4 from 14. It is only 4 post exposure doses are usually being given. So we will discuss one by one situations, how this thing is vaccination is done. So as a just some basic knowledge about immunology, virus neutralizing immunoglobulin G, that is, we know that we have 5 different type of immunoglobulins, that is IgM, IgG, IgA, IgD and IgE. But IgG is the most effective, immunoglobulin G is most effective antibody in neutralizing all kind of infectious agents. That is why we want an IgG response in rabies post-vaccinal serum. So WHO recommends IgG level of about 0.5 international unit to be as being proof as an adequate immune response. Never say that 0.5 international unit per ml of IgG, if a patient has, is protective towards rabies. No, it is not protective. It is said that if a patient has a immunoglobulin level of 0.5 international unit per ml of blood, he is having a adequate immune response after vaccination. That's all. He is not completely protected. Post-exposure vaccinations have to be done. Commonly, if a intramuscular, I will say intramuscular administered vaccines, post-exposure prophylaxis is the vaccination has to be started on day 0 before, within 24 hours of the bite. The day 0 indicates within 24 hours of the bite. Day 3, day 7, day 14 and day 28. So that is 1 ml of intramuscular vaccine into the deltoid region of adult and anterolateral aspect of the thigh in children. Usually in children, this intramuscular vaccination is not given at the deltoid site. It is given anterolateral, front portion of the thigh. It is given. In dog and cat, it is subcutaneous at neck or intramuscular at thigh. Many of us have a practice of giving vaccination on the back, dog's back, on the back, subcutaneous. No, it is not effective. You have to give subcutaneous only in the neck and intramuscular only in the thigh, not anywhere else. So this is called as 5 days with 5 doses, 5 days visit, 5 visit cases. It is always recommended that in transdermal wounds, RIGs, that is rabies immunoglobulins, are always recommended. So in transdermal, any kind of transdermal wounds, rabies immunoglobulins are always recommended. So this is about SN regimen, that is 5 doses, 5 visit regimen. This is about regimen followed during the intramuscular administration of vaccine. That is on 0, 3, 7, 14 and 28 day. What about pre-exposure vaccination? Say, for example, I am not vaccinated against rabies throughout my life. Till today, I have not been vaccinated. I am now, after listening to that, some of our participants may, feel like, okay, I should get vaccinated. I am not vaccinated yet. I should get vaccinated. Tomorrow only I'll go. So what is the protocol you are supposed to follow? You have to get a vaccination on day 0. That is, if you start today, from 7 days from today, the second dose has to be taken, and on 21st or 28th day, third dose has to be taken. Even it falls good for dogs also. WHO recommends initially when the dog or animal or human is not vaccinated, not exposed to the rabies vaccine, he has to start his vaccination with 3 doses, 1 dose on 0 day, 1 dose on 7th day, and 1 dose on 28th day, followed by annual booster single dose. Every year you have to take 1 dose per year on the specifically on the day 0. That is, you have started vaccination on 28th of this September, and next vaccination will be after 7 days, and the third dose will be 19th October, and next year your due date will be on 28th of September. Before 28th of September, you have to take the next year's dose. What about, see, I am vaccinated. Every year I am getting vaccinated. Every year I get a booster of vaccination. What if I get bitten this year? I have been vaccinated on last, maybe say for instance, I'll put it as I've been vaccinated in last January, January 2022. So my next due date is January 2023. But what if I have got bitten by a dog? So I have to take 2 doses of vaccine on day 0 and day 3. There is no need of rabies immunoglobulins in a fully vaccinated animal, even if he gets bitten by a fully vaccinated human being or animal, even he or it gets bitten by a rabid dog. There is no need to get a immunoglobulin in a already protected animal. Only 2 doses of vaccination will suffice the whole requirement. Next, in severe cases, when category 3 infection are seen, category 3 exposures are seen, the wound treatment, rabies immunoglobulin and antiviral vaccinations are anti-rabies vaccinations are essential. This rabies immunoglobulin is given at a 40 international unit per kg body weight. Nowadays, it has been reduced to based on the square centimeter area, dose per square centimeter. It is yet to be standardized. It is under study because say for example, an elephant is bitten by a dog. You may require liters together of this rabies immunoglobulins, which are very, very costly. So it is being standardized to dose per centimeter, square centimeter. So at present, it is 40 international unit per kg body weight, and it has to be given in and around the wound, not intravenous or not intramuscular. It has to be given only in and around the wound. I repeat, it has to be given only in and around the wound, not with IV or intramuscular. So this is how the immunoglobulins are usually administered. At the site of bite, it will be given. Here the animal, patient is having 2 wounds, and it is being given at the site of bite, not intramuscular or intravenous. WHO recommended post-exposure prophylaxis is 0, 3, 7, 14, 28. If it is intramuscular, If it is intradermal, it is 0, 3, 7 and 28. But on two sides, both deltoid, it has to be given 0.1 ml, 0.1 ml each on both deltoid. Whereas in intramuscular, 1 ml on single deltoid, only one side it has to be given. Only one side intramuscular has to be given. Whereas in intradermal cases, intradermal administration, it has to be given on the both the deltoids intradermally. But if you give intradermally, this 14th day of vaccination is avoided. I always have wondered that, only for rabies we have this particular peculiar schedule called as 0, 3, 7, 14, 28. None of the other diseases for that matter has this particular kind of, typical, very awkward and very confusing regimen. 0, 3, 7, 14, 28. None of these diseases have. Why this? I already told you that it is primary. After primary vaccination, there will be a huge surge of in IgM, immunoglobulin M, but immunoglobulin M is unable to neutralize the fast growing viral particles. 2 weeks, it is only after 2 weeks of primary vaccination, there will be a slow rise in immunoglobulin G. But we don't want this to happen after 2 weeks. We want immediate result. So we use a phenomenon called as genetic class switching, immunoglobulin class switching. So I'll explain in a very simple way. See, in a plasma cell, which plasma cell is a type of lymphocyte which produces immunoglobulins. Immunoglobulin genes are arranged in this particular fashion. This is 5' end and this is 3' end. And at the 5' end, initially the IgM gene will be located. That is why as a primary vaccination, IgM is secreted first. And next is the IgG. But to shift from IgM response to IgG response, it takes about 2 weeks time, that is 14 days time. But we want a potent IgG response which is very, very effective. So what we do, say for example, we are watching a movie. That's why I have given a small video reel here. We don't, there, in a serious movie, there is a, suddenly there is a awkward song coming. What we do, we just rewind, fast forward the movie and stop at the stage where the song ends. And then we start from that point to, start watching the movie. So similar thing is happening in the cell. When you give a repeated boosters at the day 3, when you give a day 3 shot, suddenly there will be a shift from Ig. Body will sense this emergency and immediately there will be a shift from IgM response to IgG response. When you give a 7th day dose, it will be peak in production of IgG, and at 14th day, it will start producing a high quantity, high titer of IgG, and on 28th day, it will start a potent memory. Why this memory word is being used is, frequently we ask, I have been asked in many of the forums, like, say, last year I was, last 6 months back, I was bitten by a dog and I have completed complete course of vaccination. And today again, I have got bitten by a dog. Do I need to get a vaccination, complete dose of vaccination? So this is why I have used a term called as memory. When you give this 0, 3, 7, 14, 28 or 0, 3, 7, 28, the 28th day's shot will increase, it will inbuilt, it will set up a permanent memory in the body saying that this is a potential hazard, and whenever it comes for the next time, I need to act very, very fast. So this is the work of, this is the activity of memory cells. So immediately when you give on a patient or a victim who has already completed this 5 doses of, or 5 or 4 doses of vaccination, if he is already again bitten by a dog, when you give 0 and 3 itself, it will start producing a high peak of immunoglobulin G, and it will be sufficient to produce a protective response against the fast growing virus. That is why we always say that immunoglobulin therapy is not required in a pre-vaccinated patients, because the 0 and 3 itself will stimulate a potent immunoglobulin response, and which is additional immunoglobulin at the site of bite is not required. I have made it as simple as that in a simple way that I can explain. So intradermal route, this is how a small bleb has to be formed. The syringe and needle has to be inserted less than 45-degree angle, at a angle less than 45-degree to your skin. There should be a small bleb. If the person is injecting at 60-degree or 90-degree to your your skin, then definitely that person doesn't know how to give a intradermal vaccination. So whenever you are getting a vaccination, kindly check if the nurse or whoever is administering, the staff is administrating, or a doctor is administrating the vaccine in a proper way. So in intradermal, as I already told you, this 14th day is actually voided. Only 0, 3, 7 and 28th days dose is recommended. There is no 14th day dose. 0.1 ml into both deltoid has to be given in humans, but in animals, this intradermal route of vaccination is still to be established. It is not yet established. We are not following this intradermal vaccination in animals. It is called as 4 doses, 4 visits. In a new patient, it is recommended that transdermal wounds are always to be given a shot of rabies immunoglobulins, that is RIGs, only in a new case. I would say only in a new case, not in a pre-vaccinated patients. So in cities, there are a lot of things going on, mission. These are some, mission rabies, and a lot of our volunteers are doing a lot of work in rabies control. Goa is under a stage where it is going to be declared as a free from rabies state. So they are capturing all stray dogs, street dogs, and all these pet dogs are being vaccinated, and community dogs are captured and they're vaccinated. They're subjected to animal birth control operations, and then they'll be left. Their relocation is a crime, so they'll be left in the same locality where they have been captured. And all these have been, there is a process of tracking all this. Each and every animal will be tracked, where it is lifted from, where it is captured from, where it is subjected for ABC programs, and where it is again placed, whether it is placed in the same locality or it has been relocated to some other places. Relocation is, it attracts a lot of problems. In rural India also, we have tried to assess as a APCRA project. Veterinary College Bangalore and KIMS Bangalore have collaboratively tried to assess the KAPs of this rural folk and knowledge about this rural Indian people, and especially the wall posters, wall paintings, and calendars for this rabies awareness creation, and especially for children, the snake and ladder games have been given this. When when you create awareness, it is said that two group of people have to be targeted. One, especially these women who are in self-help group or women volunteers have to be targeted. Secondly, people, students from 8th to 10th standard. If you target these people, the knowledge given to them will percolate to a larger folk, because women, they percolate the knowledge to a larger folk, and students also, they percolate their knowledge to a larger folk. There are many jatas. Today also there was a tremendous jata on World Rabies Day at Bangalore Veterinary College, and similar jatas have been arranged, and posters and different posters on what are the different steps to save your life from rabies, and what are the responsibilities of dog and cat owners, and how these have been demonstrated in rural area. And self-help group members have been educated about this, and a lot of initiatives are being taken up. In Mission Rabies regularly conducts drawing competition about rabies, awareness camps to students, especially in age group of 8th standard to 10th standard. And small children are, they are also trained for this rabies related activities, and their awareness is being created, and large scale jatas are being taken place. And next generation concept is oral rabies vaccination. This is specially useful in free roaming street dogs, that is nomadic dogs, free range, street dogs, and also it is very good, very useful in controlling wild sylviatic cycle of rabies. So usually this is how a oral rabies vaccine bait looks like. It is usually either egg coated or meat coated sachets which will have a vaccine. This is a, what you say, this is a pouch containing all these rabies viral particles, orally active rabies viral particles. And when the dog bites this small metal frame, definitely the rabies virus is going to be inoculated or liberated into the oral cavity. And this is a metal frame, small metal frame. This, even this, if the dog eats this will come out in the feces. So it doesn't cause any kind of, it has no sharp edges, so it is blunt edge, so it comes out in the feces. So this is how the different baits look like, but this bait has a potential public health concern. These baits are usually made in pox virus based vectors. So usually this baits, if it is consumed by rag pickers and all, it can cause some pox like symptoms in especially in children and pregnant women. So government of India is yet to give a sanction to import this particular strain called as SAD, Southern Alabama Dufferin strain 19. So this strain is not lurking in India. This is not present in India. So to import a new strain which is not there in India is very difficult. So government of India is seriously thinking on whether to import it or not. So once the permissions are granted, maybe India will also have a potential research gateway for this oral rabies vaccinations. And there is only one case as of now. It is said that there are 6 to 7 cases, but only one registered cases. That is she is Gianna Gaze. She is the only survivor after getting typical symptoms of rabies disease, and she has got all the neurological symptoms and all classical symptoms of rabies. But she was subjected to a protocol called as Milwaukee's protocol, wherein whole nervous system is submerged with the using some nerve anesthetic agents, CNS suppressing agents like ketamine and all. And she had developed a good titer of immunoglobulins in her central nervous, cerebrospinal fluid. So that is how she was able to make it up. So that is considered to be only one success story till date. And there are several, but it is authentically, it is to be registered. There are only two success stories. One is in human sector and one is in animal sectors. In human sectors, smallpox has been completely eradicated, and in animal sector, rinderpest is completely been eradicated. Now this is a year of one health. May it be rabies by 2030. May the rabies be eradicated from the globe. We have just initiated. What I feel is we have just initiated. We still need to go a long way. We still need to do a lot of things. Thank you so much. Is there any chance of rabies through milk of infected animals? Yes, it is one of the most frequently asked questions. Of course, globally, there are no records of rabies being gained by consumption of milk. The reason being, our oral cavity is full of lysozyme, and this lysozyme readily dissolves the cell wall of the rabies virus. But theoretically, I said in my presentation, theoretically, the chances cannot be ruled out, because if there are any abrasions, there are cuts or ulcers in the oral cavity, definitely there are chances, theoretically, there are chances of getting rabies. But WHO clearly says that if there is a oral consumption of milk from rabid animal, post-exposure prophylaxis is not required, not essential, because there are no sufficient scientific evidences for rabies being transmitted through oral consumption. Question number 2. If a lactating cow is bitten by a rabid dog and cow is under post-rabies vaccination protocol, then after how many days milk can be consumed by both human and calf? Of course, there is no defined withdrawal period for this rabies vaccination. Immediately after, calving, the calf can consume the milk. Once the colostrum feeding is stopped, then the human can consume the milk from a cow which is under treatment. And I'll put it very specifically, if the cow develops rabies symptoms, then it should not be consumed. If there is a needle prick of anti-rabies vaccine to the vaccinator at the time of vaccination, is there any sort of hazard? No, definitely. Throughout the globe, none of the vaccines related, none of the rabies viral vaccines have live viruses. It is all killed, inactivated virus. They are not attenuated, they are inactivated or killed viral vaccines are available. So there is absolutely no risk in such cases. Do sheep and goats suffer with rabies? Yes. If yes, what are the symptoms? They'll have repeated bleeding, they'll have repeated nymphomania, they will have changes in their gait, they will have head butting, head pressing. All these symptoms can be seen in sheep and goat. With a history of rabid dog bite to sheep and goat, what should we do? You have to first do wound toileting, wash the wound thoroughly with water and detergent soap, and then you have to go for vaccination. We use only intramuscular vaccination, so 037 14 28 is the recommended intramuscular vaccination. Of course, immunoglobulin therapy is yet to be incorporated in veterinary profession. Once symptoms are exhibited in sheep and goat, what to do? Whether to kill or see, ideally I don't suggest. I know in sheep and goat and cattle, usually I don't suggest euthanasia. So definitely 2 to 3 days they're going to die. In case of patients who are not non-cooperative, the patient owners, especially non-cooperative patient owners, you may have to take a call on euthanasia, but I don't usually suggest euthanasia. Is there any danger if a sheep and goat which is rabies positive bites shepherd? Of course, there is rabies. Even sheep saliva will also have rabies virus. Any animal for that matter, if it bites, even a non-biting animal, if it is turned out to be rabies and it bites a person or a patient, definitely it has to be taken very seriously. On trying to handle the sheep and goat bites, yes, it has to be taken seriously. When the dog bites on month-old pup, can we go post? Yes, when a dog bites 1 month-old pup, can we give post-bite ARV? Age of first dose of anti-vaccination is 3 months. No. See, in WHO has identified some of the countries, like they're denoted as endemic countries. In endemic countries, we have to give vaccination to, we have to start vaccination irrespective of age. 1 month-old puppy, maybe the mother is fully protected and vaccinated, but we do not know how much of maternal antibodies have been acquired from the mother to the puppy. So definitely, even a day-old puppy is bitten by a rabid dog or whatever dog it is, you have to start giving post-exposure vaccination to that particular puppy. Usually, I advise farmers with dog bite cases immediately wash the bite wound thoroughly with lukewarm water mixed with common salt and washing soda or washing soap. Is the primary treatment. Anti-rabies vaccination is the second action. Is it right or not? Yes, you are partially right. Common salt and washing soda has very little to do with it, but washing with soap, absolutely correct. As soon as you get a case of rabies, dog bites or any animal bites, you have to recommend the owner or farmer to go for a wash with continuously flowing cold water and detergent soap, preferably detergent soap, the soap which we use to wash clothes, and vaccination is compulsory. What will happen if a rabid dog bitten animal does not receive any post exposure ARV but wash the bite wounds with the lukewarm water mixed with common salt and washing soda or soap? Is there any chance to get rabies? Definitely there are. If you don't vaccinate it, the possibilities are very high. You said this washing, wound toileting will kill only 99%. It is said that only 99% of the rabies virus which has been inoculated through the wound will be killed by this wound toileting. That, like, washing the wound with cold water and sufficient detergent soap and application of surface antiseptics. But even 1% of the virus is dangerous, so vaccination has to be taken up. Is it necessary to get vaccinated self after a puppy or dog which has been vaccinated against rabies? Is it necessary to get vaccinated after a puppy or dog bites which is bad? Yes, this is a very tricky question that you have to take a call upon. See, if you're pre-vaccinated, then I would say you don't have to worry about it. You can just take a tetanus toxoid and then stop. If you're not vaccinated, better to go for a vaccination. So you don't know. See, earlier there was a concept that if a dog bites, you wait for 10 days to dogs to show the symptom and then you go for vaccination. No, nowadays as soon as vaccine, I said while explaining this vaccination procedure, I said within 24 hours of vaccine, dog bite, you have to go for vaccination. So you can't wait. When you wait and it's already late, you're nowhere. You're in a serious trouble. So definitely, even if a vaccinated puppy bites you, if you're not vaccinated, don't take that risk. You go for vaccination. If any animal is suspected for rabies, then her milk is fit for human consumption or not. I have already explained this. Can we do preventive vaccination in large animals with ARV? Of course, yes. The person I had shown, that Dr. Sunil Kumar, he has done an extensive study on that. Large animals do produce a good protective immune response, and based on the economics of the financial status of that owner, you can definitely go for pre-exposure vaccination. How many doses, how effective they are? They're absolutely effective. I have told you, WHO recommends human vaccination, pre-exposure vaccination at 0, 7 and 21. Same thing can be followed in humans and in animals, even in large animals. It gives a good response. What is the maximum time to start post-bite vaccination? I have told it 24 hours, within 24. Earlier the best. What precautions should farmer take while milking rabid dog bitten animals? Yes, he has to wash his hands properly after the milking. He has to wash the animal's udder properly with preferably with soap before milking. And if the animal starts showing symptoms, I would not recommend the animal to be milked. If the anyway it is going to die, and you have to take a call. Rabies virus is secreted in milk. Yes, it is secreted not only in milk, all excretions and secretions of the body. It is there in from the sweat till the semen, and it is seen in feces, it is seen in urine, it is seen in milk, it is seen in everywhere. All secretions and excretions of the body. It is seen in bile. It is seen in pancreatic, juices, everywhere. Whichever organ is innervated, all organs will get rabies virus. Will the milker or consumer taking raw milk suffer from rabies? Yes, this question I have already explained. If saliva of rabid animal has contaminated with water kept in a vessel, will the other animal drinking simultaneously of that after 1 to 5 minutes of contamination of water suffer from rabies? Yes, in the presentation, I stressed upon this point. Exposure to cold water for long duration definitely will kill the virus, and oral transmission of rabies virus is not being proved. So I think these two statements answer this question. If the rabid dog dies, how long virus will be infective from the dead carcass? Yes, wonderful question. See, it depends on how fast the animal is, dead body is putrefied. The virus cannot live in putrefied body. Virus will also go for inactivation, but a body being thrown or lying free in a cold environment will definitely delay the process of decomposition, and will the virus will prevail a longer period of time, whereas a body kept in a hot and humid condition will putrefy faster and viral will vanish very faster. What is the available method to detect presence of virus in saliva? Yes, I have told you all those tests except for fluorescent antibody test and direct rapid immunohistochemistry test can be used for virus detection in saliva. That is, you can use PCR, you can use RT-PCR, you can use loop-mediated isothermal amplification, and for certain extent, even the lateral flow assay can also be used. But absence of virus in saliva is not a confirmatory test, because you always know only when there is a squeezing of salivary gland, the virus, saliva is secreted into the oral cavity. And because there are a lot of enzymes in the oral cavity, only for a small period of time, the virus will prevail to be, will stay to be active in the saliva. That is why you many of us would have noticed that a rabid dog keeps on biting all the many animals, but only few animals will get disease, not all. Even though they are not vaccinated, even though all the animals are not vaccinated, only few will get disease, because not all the bites will have rabies virus. Not every time the saliva will have rabies virus, active rabies virus. So oral enzyme activity will also destroy this virus. So salivary sample can be tested, but absence of virus in saliva is not a confirmatory that it is negative for rabies. Which form is most common in sheep and goat and in cattle, in dog? Which form is common in sheep and goat and in cattle? Sheep and goat, you have, it is very difficult. Form of disease is explained only in dogs, not in other animals. So you have all overlapping symptoms like, repeated bleating and headbutting and attacking behavior, aggression, all that is seen in sheep and goat. And dogs, you have two different forms. Rapid test kit to check virus in saliva. Yes, for some extent it can be used. I answered this question. It can be used, but I again say negative in rapid test kit, that is lateral flow assay, is not confirmatory that the case is negative. Preventive vaccination protocol in dog. Yes, I have told you, for first time when the animal is getting vaccinated, you have to give 0, 7 and 21 and then annual boosters. Post exposure protocol, that is in dogs, we follow only intramuscular regimen. So SN regimen has to be followed. 0, 3, 7, 14, 28 has to be followed. Use of immunoglobulins. Yes, in humans it is well established and it is proven to be 100% effective. There is a question called as effect. So it is very, very effective. But in animals, there are some clinicians who are trying it. They have got good results, but it is not very well established in animals. If the dead animal thrown in water pond, stagnant water, or rabid live animal sheds saliva in flowing water, is there any chance of spread through drinking water? No, absolutely not. What are the available vaccines in market? Cost, doses, and route. Yes, you have umpty number of vaccines. Starting with our own government department of Karnataka Government Department, University of Karnataka Veterinary and Animal Science University, KVFSU, is manufacturing any RAB, which is very, very cost effective, and also Indian Immunological is manufacturing Raksha, which is very popular also. And you have MSD manufacturing this Novivac Rabies, and most of them, we have definite, Defensar and all that vaccines. Most of them, they range from, Indian, our IH&BB vaccine will cost you about 20 rupees per dose, and the expensive vaccine for animals will cost you about 280 to 300 rupees. And for human vaccines, in Karnataka, I don't know the situation in other states, all the primary health centers, not let alone this community health centers at taluka level, every facility has this anti-rabies vaccine, which has to be paid 100 rupees per APL, above poverty line beneficiaries, and below poverty line beneficiaries, it is free of cost in most of the hospitals. Why vaccination for pups is advised at 3 months of age? No, in India it is not advised. Irrespective of age, it has to be, the pups have to be vaccinated. Is rabies vaccine of human and animals is different? Yes, definitely. Human rabies viral vaccines are developed in purified chick embryo fibroblasts or vero cells, whereas animal vaccines are developed in BHK, baby hamster kidney cell lines. They're definitely different. Inactivation agent used are almost same. So they use beta-propiolactone as an inactivating agent, but the development of vaccine is completely different. What is the immunity period of rabies vaccine? Potentially, it is said that it has to protect you for 1 year, because rabies virus, I already told you, it is a killed virus. As per theory, as per immunology, none of these killed vaccines are effective for more than 1 year. But some of the human vaccines, they say, and some of the Bowling and Ingham vaccine, even for animal vaccine, they say if you give it for once, complete dosage for once, and then you forget for 3 years. No, immunology or theoretically it is not possible. So it is a very big question mark. I don't know. Maybe I may be wrong, or somebody else, if some experts are there in this group, they may suggest me. By using DNA-based test kit, is it possible to differentiate infected animal from vaccinated animal? Of course, it is not a DNA-based, it is a RNA virus. So RNA-based tests have to be done. Yes, definitely you can differentiate infected animals from the vaccinated, because infected, we are using a fixed virus in vaccine. Usually either Dr. Largy's strain or some other strain will be used in vaccines, whereas in an infected patient, you will have a different types of genotype 1 viruses. Of course, there is not much changes, but only thing, those conserved regions have to be targeted. Definitely you can do it, but of course this is not a this is not a matter for scientific research, because infected or vaccinated, there is absolutely no possibility that a vaccinated animal will get disease from the vaccine. Because of the vaccine, the animal cannot get disease, because all these viruses have to be inactivated before they are put into vaccines. So vaccine acquired infection is definitely not possible. There is a stage of viremia as written in a book. No, absolutely there is no stage of viremia. Virus excretion in urine. Yes, virus will be there in urine, but there is no stage of viremia. Virus is never ever seen in blood. Rabies in cattle, ruminants, is zoonotic or not? Yes, if unfortunately animal handled, if you put hand in its in the rabid cattle or ruminant's mouth, and he gets bitten by that, definitely it can be infective. But ideally, as per books, cattle are said to be the dead end host, because they do not have a biting tendency. In saliva of rabid affected sheep, is it infectious? Yes, it is infectious. If rabid sheep bites shepherds, is it dangerous? Yes, this question already I have answered. It is dangerous. Will rabies affected sheep and goat abort? Yes, it's a matter of chance. There is no direct relation between rabies and abortion. Of course, it can abort or it cannot abort, but there is no direct relation to rabies and abortion. Will affect did the sheep transmit rabies to another sheep in same flock by licking or biting? Yes, if it bites, definitely. By licking on an open wound, definitely it can. But licking on other areas, definitely it cannot. If a rabid bite, rabid affected human being bites another person, what will happen? Definitely the bitten person, if he doesn't take proper care of wound and if he doesn't take up this post-exposure prophylaxis, he'll definitely get rabies. Is milk from rabid cattle consumed after boiling? Yes, absolutely no problem. Boiling will destroy all the viruses. Is brain also infectious on handling? Yes, definitely. Definitely, brain is very, very infectious on handling. If vaccinated dogs bite, what schedule must be followed? Of course, this question I have answered, but I will again answer it. You have to take a call. See, it always depends on how confident are you on your vaccination schedules and how confident are you on your patient that it has not come across with any kind of dog bites. Okay, so all are requested to post questions in chat box now. Okay, that is curd from rabid animals milk safe to human consumption? Of course, curd will ferment milk. Definitely rabies virus will die, so it is safe for human consumption. Sir, is there any contraindicatory effect of using NSAID, SIDs and antibiotics along with vaccines? Yes, some people recommend not, use of, to restrict, some people recommend to restrict use of steroids, steroidal anti-inflammatory and non-steroidal anti-inflammatory drugs. But as per immunology, there should not be any problem. Can we drink milk from a cow whose calf is bitten by rabid dog as milking is done while calf is suckling? Yes, this is again a very, very, very theoretical question. Of course, you have to observe, and if the calf is bitten by, a dog, and better to avoid, directly allowing the calf to the udder. You can definitely feed it with the bottle or something like that. Thank you so much, sir. Such a big information. Thanks a lot. Excellent presentation. What will be the vaccination protocol when vaccinated animal bites to other vaccinated animal? Yes. Again, it's a typically hypothetical question, and the biting on the biting vaccinated animal should be very clear that there is no exposure to the other dogs. If the dog which bites has no exposure to other dogs or any bite histories, so you don't have to go for really worry about vaccination. Sir, you said 3 vaccines for the first time. In dog vaccine, there are done at 90 to 120 days vaccines. No, that is wrong. That is wrong. So ideally, in recent past, it was being given at 0 and 21 primary doses to dogs, but it is recommended that you give at 0, 7 and 21. Sir, as you have mentioned, salivary lysozyme will kill rabies virus. So if a rabid wound washed using detergent soap with followed by salivary paint will, oh my God, what a question this is. Salivary paint, no. Of course, don't do it. Don't do any kind of chance. You have already Aftab Hussain. Okay, Dr. Aftab Hussain, see, you have a very well established protocol, so there is no need for extra things to be done. See, washing with soap and water will kill 99% of the viruses. So it has done the same thing which a saliva would do, but 1% of the virus which remains in the wound definitely it is infective. So salivary painting, very, very, innovative question. I liked it actually. Very informative and excellent presentation, Dr. Nidhi. Special thanks. Can human animal vaccine can be used vice versa or not? No, they cannot be used vice versa. Human vaccine has to be used only in humans. Animal vaccine has to be used only in animals. At what age first vaccine must be given? So ideally, irrespective of age, the vaccine has to be given. But in a very good dog having a very good history, you have to give first dose of vaccine at least before 3 months of age. Before 3 months of age, at least one dose of vaccine has to be received. If virus is not released to blood, then how neutralization of virus happens by antibodies? So, Dr. Sunil Pradhan, antibodies are seen everywhere and everywhere. Antibodies are not only seen in, blood. They can penetrate into each and every body part, every organ of our body. So antibodies neutralize even in muscle, even in eyes, wherever it is possible. This IgG. That is why we are creating an emergency. We want a IgG response. IgM is a pentamer. It has 5 molecules, which is bigger in size. Okay, so we want a smaller molecule called as IgM, immunoglobulin G, sorry, IgG, which can penetrate deeper into the tissue. So it can neutralize in anywhere and everywhere in the body. In the pup, what is the age first vaccination must be given? Yes, I have already answered this question.
Sir, one Mr. Krishna Mohan sir raised his hand. Krishna Mohan sir, please ask your question.
Am I audible?
Yes, sir.
Yes, you are
yes,
audible, sir.
One question, that is, will the start of post-vaccination regime after a dog is bitten, will it guarantee us from totally safe?
Sir, if you follow all these procedures, wound toileting, I said wound toileting is very, very essential. Okay. If you have very much confidence on the owner, and as soon as you have received this patient, you have identified. See, especially in dogs, it is very difficult to identify the bite marks because they are all hairy. Identifying each and every bite mark is very difficult. So if you have done all that, definitely you can be very sure that the animal will not get disease. Only the exception is if the animal is got bite on the head, which is very close to the brain and spinal cord, then you cannot assure them. Otherwise, if you have taken care of all these things, definitely you can assure them.
Thank you.
Yes, sir.
Thank you, Krishna Mohan sir.
Thank you.
Any other hands raised?
Sir, participants, please note the mobile number of Dr. Nitin Prabhu, sir. It is 98449. Sir, are you able to see this?
No.
Okay.
So I'll put it in type.
No, sir. No, it is okay now.
Yes, I am able to see it now.
Respected participants, please note the mobile number of today's speaker, sir, Dr. Nitin Prabhu, 98449 95078. 98449 95078. And here I have given his email ID also. So in future, whenever you get a doubt, you can contact him through mobile or through email. Sir, now I request today's special guest, sir, to acknowledge the participants, sir, to acknowledge the speaker.
At the outset, to the speaker, my friend Dr. Nitin Prabhu, he has given a wonderful presentation. Actually, with his vast experience, because he has done a lot of work during his PhD on rabies and the crucial rabies lab, where he has worked with his guide, Dr. Shri Krishna Islur and Dr. Itiraj sir. So a lot of work actually he has done on the rabies, and even his fellow classmates were doing the other part of the rabies related work. So he has gathered a lot of information, and basically he is a very innovative person, and he is interested in all these type of research activities, which he has even proved even after becoming veterinary officer. As an extension officer, he has got many awards, and he has done a wonderful lab to land activity as a veterinarian. Even after acquiring the PhD, he has utilized his knowledge to the perfection. And today I understand that he has delivered a wonderful lecture, both from the microbiological point of view and immunological point of view, and to all the field veterinarians and to all the farmers, even if anybody who is not vet, who has as a shepherd or as a farm owner who has attended this talk, definitely it is a very knowledgeable talk. And after attending this talk, definitely most of their doubts might have been cleared. And on behalf of Zerograzing. I thank Dr. Nitin Prabhu for giving this wonderful talk. And at the same time, I acknowledge and I thank all the participants who have participated and attended this webinar and made this webinar a more successful event. And they have asked the relevant questions. Actually, the wonderful questions have been asked. Some of the questions were very tricky, and it's very difficult to answer some of the questions because they are unless until in diseases like rabies, there are a lot of ifs and buts are there. Even though 99.9% things have been proved by doing a lot of research work and other things, but still a lot of many other things will be there if and buts are to be answered. And Dr. Nitin Prabhu has tried his best to answer many of the questions scientifically and with his experience. Thank you one and all, and thank you Zerograzing.
Thank you, sir. Thank you very much. On behalf of Sathyazerograzing, we express gratitude to today's speaker, Dr. Nitin Prabhuke, and to the special guest, Dr. Shivaraj sir. We express gratitude to both the advisors, Dr. Kiran Kumari and Professor Kavita Rai. Thanks to all the associates, promoters, and all the participants. Our next webinar is scheduled on 2nd October. That is, it is a regular webinar, Sunday at 5 p.m. Profitable goat farming in Northeast region of India. Speaker Dr. T. Gyaneshwari Devi, Assistant Professor, Department of LPM, Nagaland, College of Veterinary Science and Animal Husbandry, Central Agriculture University, Nagaland. Respected participants, today we have seen a field veterinarian. That is, Dr. Nitin Prabhuke is a field veterinarian. He has presented it in an excellent way. See, many of our doubts have been cleared by him. And if anyone of you is also interested to deliver a webinar lecture from this platform on sheep and goats, just to send me a message on 8500404016, and it can be a short length video also. It need not be a regular webinar. You can do a short length video through which you can share your field experience on a particular disease or particular problem you have faced and solved. And it can be in your local language also. It need not be in English. And there is one national seminar which is going to be held in the month of November at ICR CSWR Avika Nagar from November 10th to 12th. It is organized by Indian Society for Sheep and Goat Production and Utilization. The topic is prospects and potential of small ruminants production for enhancing income under changing scenario. If anyone of you is interested, the last date for applying for registration is 15th October, or you can see their website, www.isagp.org. Respected participants, learning is a continuous process, and do attend all the webinars and watch the YouTube channel for previous webinar recordings. And if anyone of you wants to join the WhatsApp group for daily updates on sheep and goat, send me a message on 8500404016. This is my WhatsApp number. Thank you all. Thank you once again. With this, we close this webinar. Thank you, speaker sir, and thank you, special guest sir.
Thank you, sir. Thank you.
Thank you. Thank you.